We'd like to welcome everyone to the session on combating provider caregiver burnout with Johansei Hodge. She's a graduate of Morgan State University with a master's in mental health from McDaniel College. She is a Baltimore County crisis specialist, and I'm going to give it over to her for the rest of the session.
Thank you so much. Like she stated, my name is Johansei Hodge. I am a LGPC, so a licensed graduate professional counselor. By day, I like to say by day, but really all day or all the time. I am a full-time mental health therapist in the Baltimore area. At Wynn Family Health, and because that's not enough excitement, I am also a phone counselor at Baltimore County Crisis Response. I'm really excited to be here with you guys today and kind of talk about caregiver and provider burnout a little bit. So I'm going to go ahead and share my screen and we'll get started. Okay, so as I stated before, we'll be talking about combating provider and caregiver burnout. So some of the things we'll be going over today are what is provider and caregiver burnout? What are the signs and what do they look like? Can we prevent it and what help is available? I am going to prefix this by saying I am a New Yorker. I am also a Latina. I talk very fast and I cannot control when my accent comes in or out. So just please let us know in the chat if I'm going too fast or you can't understand what I'm saying so that I can adjust to the best of my ability. I would greatly appreciate that. So, all right, so we'll roll right into it. What is burnout? So I kind of categorize this in two separate sections, although a lot of the caregiver burnout a lot of the provider burnout is going to look very similar to the caregiver burnout, if that makes sense. I hope that makes sense. So caregiver burnout is defined as a state of physical, emotional, and mental exhaustion. It may go along with a change in attitude from positive and caring to negative and unconcerned. Burnout can happen when you don't get the help that you need, or if you try to do more than you're able, either physically or financially. Caregivers who are burned out may have fatigue, stress, anxiety, and depression. Many caregivers also feel guilty if they spend time on themselves rather than with ill or elderly loved ones. And literally that whole definition can be used for provider burnout as well, literally just by subbing out rather than with their ill or elderly loved ones to with their clients or patients, depending on the view of the provider. Of course, we're going to have medical professionals and then, of course, mental health professionals and that change in language. So what is provider burnout? Provider burnout has been classified as a physiological syndrome that can be expressed as a prolonged response due to chronic occupational stressors. So any job in which we are caretakers, caregivers, advice givers, any career that's in the medical or mental health field, teaching, any kind of career where we're nurturing to other people can of course result in burnout. I'm sure any career could result in burnout, but we're specifically talking about the burnout of caring for another person's health or well-being or finances. So just making that distinction. Another distinction that I thought was really important to make was for compassion fatigue. So compassion fatigue is a broadly defined concept that can include emotional, physical, and spiritual distress in those providing care to another. It is associated with caregiving where people or animals are experiencing significant emotional or physical pain and suffering, right? So Compassion fatigue can happen in a session. It can happen in one. It's that overwhelming empathy that happens when we are in a caretaker role, or we are in a job or career that depends highly on the care of others who are in emotional or physical distress. The clear difference that I think is important to make is that compassion fatigue is going to have a rapid onset while burnout emerges over time. So it also has a faster recovery time, and it's less severe if it's recognized or managed. So what do I mean by that? Compassion fatigue might be, I am a therapist to a teenage girl who experienced an intense amount of trauma or maybe sexual abuse or assault. I may feel drained or emotionally tied to that situation. It may be a little dreadful. I may feel a little bit heavier, but the feeling of that is not necessarily prolonged, right? I may be able to quickly resolve that. Maybe I hang out with my family. Maybe I decide to mentor other teenage girls. Maybe I, can talk about my experiences or just different things. It's going to be more rapidly resolved because it's more so it can in my brain, the way that I make it make sense, and hopefully there's some other neurodivergent people here and this makes sense for them, is that compassion fatigue is sort of like empathy fatigue, right? So you're an empathetic person, you feel a lot of empathy, and so in that case you're kind of pulling on the feelings and the symptoms, maybe not the symptoms, but the feelings and the pain of the people who you're helping, right? So that's a little bit different than burnout, which is prolonged, and we're talking about lengths of time of not being able to care for ourselves, or, well, we'll talk a little bit more about that. Okay, so how does this happen, right? How does it happen? How do we come in bright-eyed, bushy-tailed, ready to help others? And at what point do we forget how to help ourselves, right? We're masters at explaining to others, how they should do it, what steps they should take. We're helping our clients budget. We're helping our clients set boundaries. We're helping our family members with everything, right? From our family members or, others in or loved ones, I guess I should say, because everyone may not be exactly family, but we're helping those people in our lives with these same skills that we seem to at some point start to struggle with ourselves. So how does this happen? Caregivers are often so busy caring for others that they tend to neglect their own emotional, physical, and spiritual health. The demands on the caregiver's body, mind, and emotions can easily seem overwhelming. And so that's going to lead to your fatigue, your helplessness, and ultimately burnout. So we're continuing to see people in certain situations. We're working in inner cities. We're working with impoverished communities. We're working with severely or chronically mentally ill patients. We're working with severely or chronically ill health patients. And so we're putting their needs and wants above ours. We're feeling, we kind of come into it feeling like we have this figured out. We are starting from maybe a better starting point than those who we're helping. So we start to neglect ourselves, right? Because we don't have it as bad as, right? And there's a lot of danger in that. What are some other factors that can lead to caregiver burnout? So these are just a few. There's a lot of different ways that this can go, but there's role confusion. So many people are confused when thrust into the role of caregiver. It can be difficult for people to separate their role as a caregiver from their roles as spouses, lovers, children's friends, or other close relationships. And when we talk about entering the mental health field or the medical fields, we often go from being the student, the intern, the person who maybe doesn't have all or every responsibility, to being that primary person. And sometimes that happens in the blink of an eye, right? And so when we think about the way that the pandemic has shifted family dynamics in this country, throughout the world, actually just globally, there's so many people who were thrusted into roles either earlier than they expected by either losing one or both primary caregivers for the family, people who are having long-term effects of COVID, such as strokes or loss of mobility or needing help breathing. So people who were otherwise maybe perfectly healthy before March of 2020 have kind of been, have become chronically sick or have unfortunately passed away. And so there is a lot of role confusion that'll happen because, this person is now the primary caregiver. Of course, this would look the same if a family friend or relative were to suddenly be diagnosed with a new condition or have their first psychotic break or any of that. So all of that can lead to role confusion. Unrealistic expectations. Many caregivers expect their involvement to have a positive effect on the health and the happiness of the patient. And this may be unrealistic for patients who are suffering from a progressive disease, such as Parkinson's or Alzheimer's, but also when we're talking about chronically mentally ill patients. So when we're talking about schizophrenia, severe bipolar, and just other places where sometimes we don't see our impact. So again, a lot of us come into the career kind of having some sort of caregiver or Superman or Superwoman complex, and we want to see the change. We want to see the impact that we're making in our clients and our patients and our family members' life. Because that's the reward, right? And we don't always get to see that. So sometimes we're pushing because we're looking for that pot of gold at the end of the rainbow. It's important for us to understand that that is not always the case. Every situation, especially when we're dealing with someone who is chronically ill, doesn't necessarily have a silver lining or an obvious silver lining, I should say. Lack of control. Many caregivers become frustrated by the lack of money, resources, and skills to effectively plan, manage, and organize for their loved one's care. And this would be the same frustration in the medical or mental health fields as we view our limitations, especially in this country, with insurance, healthcare funding, lack of programs, lack of resources. We become very frustrated that we believe that we could have a very easy fix to being able to help our client or patient or loved one. However, there's a finite amount of resources and we're not always able to do that. Unreasonable demands. Some caregivers place unreasonable burdens upon themselves, in part because they see providing care as their exclusive responsibility. Some family members, such as siblings, adult children, or the patient himself, him or herself, may place unreasonable demands on the caregiver. They also may disregard their own responsibilities and place burdens on the person identified as a primary caregiver. And of course, this is going to be a little bit maybe more abundant on the side of caregiver or caretaker, but with professionals, it's the same can happen, right? So we are expecting ourselves, if we go back to the lack of control, we are expecting to be in control. We are expecting to be the provider and the main person there. And we're afraid to ask for help because sometimes that means failing, right? So if I have a caseload of 20 or 30 and I'm feeling like I'm fatigued or I can't manage it, I'm looking at myself like, oh, well, what's going to happen when maybe that becomes 40, or should I take on 40, right? And sometimes we're looking at that as a failure versus just understanding our own limitations or being able to ask for help. And then there's just other factors. Many caregivers cannot recognize when they are suffering burnout and eventually get to the point where they cannot function effectively and they may even become sick themselves. And that's a really big one because we anticipate that people who are social workers, therapists, doctors, nurses, CNAs, anyone in the helping profession, we anticipate that they're going to be tired, right? We often are saying these things to these professions as soon as they graduate. Sometimes we're saying it before they even graduate. They're just in college and you're like, oh, what's your major? Social work. And they're like, oh, expect to be underpaid and overworked, right? So we're saying this from the beginning, and we're almost normalizing that someone should be stressed or burnt out because of the career that they chose. So we have to be really mindful of that. And I honestly hope I'm not talking too fast. So because a lot of us struggle with recognizing what this looks like, what are some signs of caregiver and provider burnout? So some of them include withdrawal from friends and family. So you're kind of just going to work, coming home, maybe working from home, all day, and kind of not hanging out with those we care about. We have a loss of interest in activities that you used to enjoy, feeling blue, crappy, hopeless, and helpless. There may be changes in our appetite, weight, or both. Changes in our sleep pattern. We're getting sick more often. We're emotionally and physically exhausted. We may be using alcohol, sleep medications, or other drugs too much. And in extreme cases, I guess maybe I shouldn't use the word extreme, but feelings of wanting to hurt yourself or the person for whom you are caring. So just always keeping in mind that there is always help, there are always people there, but the reality is that these feelings do come up, right? There's resentment from the caretaker, especially in a caretaker role. There's resentment that caring for this friend or family member or loved one is stopping us from living our full life. So we have to be mindful of that as well. What does that look like on the provider side? There's a compromised level of care for clients. There's an avoidance of clients. So we may not be responding in a timely manner. We may watch emails come in, kind of not really do anything about it, not really want to answer the phone. We may dread working with certain clients. So we're like, oh my gosh, it's Tuesday at 3. I cannot believe it. Absenteeism from work. So we're just, and this is not always in the physical sense. This is almost always in the mental sense, especially when we're talking about the helping professions. We're often not taking days off. We're there, but we're not actually there. So we're quitting or we're taking time off, which is, I believe, pronounced attrition, but English is my second language, so we may come up with other addictions, so shopping, being a workaholic, compulsively eating. This may cause problems in our own personal relationships, problems with intimacy. Like we stated before, we're going to distance ourselves from our friends and family. We may have heightened anxiety or irrational fears. So that may manifest in like, if I can't do this for this person, if I can't answer, if I can't be there, then I'm going to be the reason that XYZ doesn't happen. An increased sense of personal vulnerability. We may be hypervigilant. It may be difficult to separate our personal and professional lives. There's a failure to nurture and develop non-work related aspects of life, so such as dating, parenting, extracurricular activities. There's an exaggerated sense of responsibility. So we're not taking off, or we are taking off, but we're still working. We're going on vacation. We're taking our work laptop. We're not turning off our work phones. We're giving clients our personal numbers. We believe that everything is revolving around us and the care that we're providing. And we may be feeling professionally helpless, and we have a diminished sense of enjoyment of career, right? And so we see this a lot with physicians and nurses and other medical professionals that worked during the thick of the pandemic. You see a lot of people retiring early, a lot of people just changing careers altogether, and so we're seeing a lot of that. We're seeing a lot of people being burnt out and no longer finding joy or enjoyment in the career that they decided to go into. So I'm a visual person, so I thought it would be important to give a visual representation. And so how does this all go down, right? Because you don't start at caregiver burnout, and there's an even deeper level, which we're not addressing for this presentation. But there's caregiver stress or caregiver burden. So this is, I have to get home by 9 to do the medication, or I have to work this weekend to get these notes done. It's emotionally exhausting, but we're pushing through. It may be happening once or twice, but it's not affecting our full lives as of yet. Then that's when that caregiver fatigue is going to set in. That's that physical exhaustion. So now we are literally feeling tired. We're starting to feel the effects that it's having on us, right? Physically. And so we know that when with stress physically, it can affect our digestion, it can affect our sex drive, it's going to affect our thinking. So it's going to affect all of those things. And this is all happening in that physical exhaustion phase. We may be getting sick more often. We're just not feeling well. And then comes that mental exhaustion, which combines those two things, right? So it combines the guilt and the burden from the emotional exhaustion level, and it with the physical exhaustion. So that's where we're at our caregiver burnout, which is what we're talking about. And then there's that chronic negativity that can come from long-term caregiver burnout, which is caregiver depression. And like I said, we're not fully diving into that in this presentation, but it's definitely something to be mindful of, and why we definitely want the buck to stop at caregiver burnout if we haven't been able to stop it even before that. Whew. So this is going to explain it a little bit better. Caregiver stress and compassion fatigue. So this is the daily stress of coping with and caring for another, as well as the secondary trauma of compassion fatigue that affects caregivers' emotions. So that was step one. As step two, we have that caregiver fatigue, the stress of not getting adequate sleep and rest. Consistently worrying about your patient affects you physically. Just as chronic fatigue is a physical problem, so is caregiver fatigue. And it is also compounded by the previous step of compassion fatigue and caregiver stress. We're having caregiver burnout, which is step three. So this is adding caregiver stress and compassion fatigue and emotion, which is emotional exhaustion, to caregiver fatigue, which is physical exhaustion. And the next step, caregiver burnout, affects you mentally as things that you inspire, are passionate about, your drive, your enthusiasm are stripped away, allowing for more tedious and unpleasant thoughts to emerge. And then the final step is depression. So it is important that you take note if you find yourself suffering from caregiver burnout, as you are just one step away from depression. At this point, you may be forced to take time off work or get medical aid or quit your job altogether as you try to recover. If you cannot afford to take time off, please find other ways to look after yourself now. Woo, okay. All right, so ways to avoid or overcome burnout or fatigue. So I think it's important, if we're talking about how something happens, that we also talk about how to fix it. So a lot of these tips are tips to overcome it, are also going to be our tips to prevent it. So it just depends on whether you're doing it before or after or during, right? So we want to find someone we can trust. So a friend, a coworker, a neighbor. If you're caring for parents, your siblings, if you're caring for just one parent, or you're helping your parent care for just one parent, the other parent, you want to have a support system. You want to be able to talk about your feelings and frustrations. It is a lot harder, we find, in communities of color to talk about a burden of caring for a friend or family member, right? We believe that it is our responsibility in many of those communities to care for our friends and family members who can no longer care for themselves. And because that is really important to us as individuals, we have to be mindful to have a support system, and a support system that's like-minded and understands the stress and anxiety that comes with the betrayal, or a twisted fate of survivor's remorse, I guess is the best way to put that. You also want to set realistic goals. You want to accept that you may need help with caregiving and turn to others for help with some task. So the most important thing, especially if you're if you're a person in the medical or mental health field, is just knowing what you can take on, right? Every project is not going to be a project that you can do. Every client is not going to be a client that you can care for. Every task is not going to be a task that you can add to your plate. So you want to be mindful of that. And when you're a caretaker, once again, you want to also be realistic, even before going into the role. What is this going to require of me and how much can I give, right? What are my boundaries? We want to make sure that we're establishing boundaries early on. But if for whatever reason we didn't have those early on because we went in very optimistic, very bright-eyed and bushy-tailed, then we want to make sure that once we see what's going on, that we start putting those boundaries in place. And always remember that it's important to be able to take time away from. So taking time away from the patient, member, the loved one, that's going to be really important, even if it's just, you go for a 20-minute walk every day, or maybe you have a day off or two every week. Whatever it is, we want to make sure that we're separating ourselves from the task, from the activity. We want to take advantage of respite care services. So especially when we're caretakers for a friend or family member, but also when we are in the care field, right, in the medical mental health field, we want to make sure that whatever is already in place for a client that's in crisis outside of your hours, allow that process to take shape. We don't have to intervene. We don't have to feel like we have to be there 24/7. We want to make sure that the agencies that we're working for, or if we're in private practice, that we are describing to our clients at the very beginning what our crisis protocol would be if something were to happen outside of hours. But we want to make sure that we enforce that. Many times our agencies have these policies in place, right? They have like an on-call staff or on-call place or somewhere that the calls are rolling or going. But we're not taking advantage of those because, again, we have this superhero complex and I'm the person who can help my clients. And that can easily and quickly lead to burnout and fatigue. We want to be realistic about the disease, especially if it's a progressive disease. So we want to be knowledgeable about what's to come. We want to be knowledgeable about what our expectations are. And we also, before even going into a caretaker role, especially if it's for a friend or family member, we want to know what our boundary is. Where will this end for us, right? And so is there a level that you feel the person may need to go into assisted living? Is there a threshold for that, right? And discussing that as a family, discussing that as a support system and figuring those out. Here are some more. Don't forget about yourself, because if you're too busy caring for someone else, set aside time for yourself, even if it's just an hour or two. Remember, taking care of yourself is not a luxury, it's an absolute necessity. So again, we don't have to be taking work calls on our way to and from work. We don't have to bring our work computer with us places. We have to remember that we too are human beings and we too have to care for ourselves. And that if we break down, it's going to be much harder for the system to keep going, right? And so we want to make sure that we're taking care of that. We want to talk to a professional. Most therapists, social workers, and clergy members are trained to counsel individuals dealing with a wide range of physical or emotional issues. Even if you are in the mental health field, we are not our own therapists, doctors, and social workers. So we want to make sure that we still are seeking that help for ourselves if we feel like we need that. You want to know your limits and be honest with yourself about your personal situation. You want to recognize and accept your potential for caregiver burnout. That's going to be different for everyone. So if you're a sibling group or set, everyone's not going to be able to carry the same amount of responsibility. We have to be able to normalize that. If we're in an office setting or you're a supervisor, all of your workers may not be able to handle the same workload. And that's just the reality. We're individual people. We have individual personal situations. And so there's going to be different limits. So we want to be mindful of comparing, especially in this field, of how much we can handle. There isn't any award for being the most overworked. You want to educate yourself. The more you know about your career or the illnesses that you're treating, the more effective you can be in caring for the person. So knowing that certain diagnoses may require more time and dedication from you, or just knowing how knowledgeable you are in treating certain conditions is going to be very important. Knowing what your limitations are. As a young therapist myself, and I mean not young in chronological age necessarily, but just like young in the career, I also need to be mindful of what my limitations are. Taking on a client that could be above my range or level of work can highly affect burnout, can highly result in burnout, because I'm actually working above my own needs. So I'm overworking in that sense. We want to develop new tools for coping. Remember to lighten up and accentuate the positive. Use humor to help deal with everyday stressors. As we go into these new roles, or even our current role, we have to understand that things do change. And as things change for us as individuals, our coping skills will change. Something that I tell my clients all the time is kind of keep notes of what coping skills are working, but also keep note of when you tried a coping skill that normally worked for you, and it's no longer working. And I'm so sorry that I keep saying, I guess I'm nervous, I'm not sure. But here we go again. Woo. Okay, so keeping note of what is actually working for us versus what is not working for us is going to be really important, because even though something may have worked for a very long time, it does not mean that that's going to continue to work. We want to stay healthy by eating right, getting plenty of exercise and sleep. I know that this is very idealistic. I know that all of us are not able to exercise every day. I know all of us are not getting the amount of sleep. I understand that we work very consuming jobs. And then we're also, have personal lives, but just try to figure out what area of that you can attack successfully. And then as you successfully get one under wraps, the rest can kind of come with that. And then the last two is accepting your feelings. Just remember that having negative feelings, such as frustration or anger about your responsibilities or the person from who you're caring for, is normal. It doesn't make you a bad person or a bad caregiver or a bad insert name here to be tired or to be upset or to be angry in a moment. That's perfectly normal. We're human beings. We're adjusting to the changes that are happening around us, and we're not always able to have the most positive outlook into things because we're not just these rainbows and sunshine kind of people. We want to join caregiver support groups. So this is especially important for those of us who are caring for friends and family. I know some of you that may be clinicians or other health professionals are kind of like, join a support group, but your support group is kind of those friends that you have in the field, being able to hang out and not be talking about work, or maybe be talking about work, but just having those people who you can go to when you're feeling stressed, when you're feeling those frustrations, that isolation, having those that you can go to that are in similar situations, because it's a lot harder for your accounting husband to understand why you're so caught up over a case. It may be harder, I should say, than it will be for maybe your fellow social worker or fellow therapist friends. So there's that. These resources are specifically for caregiver burnout. So we're talking more about those of us who are caring for a friend or a family member. But that doesn't mean that these are not resources that we can look into for our clients if we're feeling like they're needing a higher level of care. Or if we're helping a client who is a caregiver looking for other levels of care for the person who they're caring for. So home health services, these agencies are going to provide home health aides and nurses for short-term care if you're acutely ill. And some agencies provide short-term respite care, adult daycare centers, nursing homes or assisted living facilities, private care aides. And with adult daycare, with adult daycare, we're also looking at, like, for example, if you have a child or a loved one with special needs, we're looking at specialized daycares in that area as well. Private care aides, caregiver support services, so support groups or programs that are going to help us recharge our batteries, different agencies of aging, and of course, just agencies of insert condition here, right? So this is not just for aging, although, typically we were thinking about caregiving as an aging thing, but we're seeing that things are affecting people younger and younger, but also that there are other conditions that are not related to age that also require a caretaker. And then there's national organizations, of course, and those are going to be your insert condition here, organizations that have national different support groups. And we can use social media, of course, as help. It's going to be a good place to find out who our support group can be. And it's also a good place, if used effectively, where we can find other people kind of looking for the same type of relief or resources. Here's some resources for professionals. I do believe that this is going to be posted, but these are two articles and just readings that I think are pretty good for you to look at. So one is from the American Psychological Association and the other is from the Mayo Clinic. And they both kind of talk about preventing burnout, building your resilience, knowing if you're at risk for burnout, how to spot it, how to take action. So these are definitely two good resources as well. I would like for everyone to keep in mind that we all need extra help from time to time, and we should not be afraid to ask for professional help. If you are looking for a therapist or just provider in your area, your insurance should be able to help you with that. Most areas also do have crisis hotlines that are able to help you with that. NAMI is, of course, able to help find different resources and has different support groups on their websites. This is, and I'll leave this here for a little bit, but also, of course, this will be posted. At least in Maryland and many other places throughout, there are specific hotlines to counties that these are both crisis/suicide. But just remembering that you don't have to have suicidal ideation or suicidal intent to call these places. These crisis hotlines can help us identify resources in our communities, even if it's just different websites or places that we can go to. So we don't only have to, when we think about crisis lines, we don't only have to think about suicide, but of course, a way to get connected to any crisis line near you is, of course, to call the national number, which now is also a text number, but you can definitely, if you're living in the Baltimore area, I try to do at least one county. I live in Baltimore City, so I try to do the surrounding counties to Baltimore City. So I don't have like Prince George's and stuff up here, but of course you guys could feel free if there is a crisis hotline that is not listed here, or you weren't able to screenshot it or anything like that, just drop it in the chat box and I can definitely make sure that I provide that to you during our question and answer. So yes, definitely utilize these resources. So what I wanna, as we start wrapping up, these are the things that I want you to think about. So definitely take a mental note, take a physical note, write these out. These are questions that we want to be mindful of, right? When we're talking about these signs and symptoms, what stuck out for you? Were there signs, were there symptoms that you identified in yourself or in those around you that may look like it's leading towards caretaker burnout. What signs or symptoms do I bring home with me the most often? So am I someone who's constantly thinking that I am abandoning my clients by not going? Am I someone who always feels guilty? Am I someone who always feels frustrated? Am I someone who gets frustrated easily? We want to be mindful of that. What am I experiencing at work? Right? Which of these am I experiencing specifically at work? Which of these, what do you have to lose if you don't deal with this? Right? Like, what quality of life, what things are you missing out on by not being able to deal with the occupational hazard or the caretaker fatigue or burnout? What do you stand to gain from having improved self-care? Right? Think about all of the things that you stand to gain by setting good boundaries, by having a good and solid routine. What can you gain from that? And who are going to be your biggest supporters on your self-care? Everyone should have at least one self-care police person in their life. If you don't have that yet, I strongly advise you to look at your friend and family group. Someone should be looking at the giver, right? And if we're at a job, or a career, we want someone at that agency, coworker, someone there should be asking you and actively enforcing and helping you figure out how to care for yourself. So whether that's finishing a book uninterrupted, taking a shower uninterrupted, getting a hot meal, getting a massage, lounging on a beach, whatever self-care looks like for you, there should be at least one person in your life, if not yourself, at least one other person who is willing to continuously ask you what you're doing for yourself. What have you done for yourself lately? So this is the goal. We want to go from emotionally exhausted or physically exhausted or mentally exhausted or even depressed to being able to look after yourself, to finding rest and relaxation, to finding good food and exercise, and to having a more positive thinking and better organization style. That's what's going to take us from this lady with 8 arms to my favorite place, which is the beach. And I hope that you all were able to get something from this presentation. If we have any questions, comments, or concerns, please let me know. Again, my name is Johansei Hodge. And hold on. Here we go. So again, my name is Johansei Hodge. And it was a pleasure sharing some time with you all today. So you guys will let me know if we have any questions or comments, and I'll be right here. Yes, it's very important, Ms. Brown, for us to have those accountability partners. Thank you, Ms. Thomas, for letting me know I wasn't talking too fast. I do appreciate that.
Are there any more questions that are coming through from the site?
Yeah, there are a couple comments. I'm putting them into the chat right now.
Okay.
Okay.
Thank you so much for, I'm a caregiver, for how exhaustive that was. And it wasn't just problems, but you walked us through to possible solutions. So thank you for giving solutions, because sometimes we're so inundated and covered up with all the things that are happening. I'm a multi-generational caregiver.
Yeah.
So sometimes there's so much going on. It's like, okay, what do I do?
Yeah.
Do I check out? What do I do?
Yeah, and I completely agree. It is much harder. One of the comments was that places to get respite care for the mentally ill are much harder to find, and that is absolutely true. And I did cover in my presentation, I did try to touch on that with the fact that these are the things that lead us to having more burnout because there's a finite number of resources. So we are not the Congress people most of the time, right? We're not the people in charge of the funding, but we're those at the bottom who are getting the brunt end of the work. So it's really important that we notice that. And so we try to figure out what are our micro solutions, what are going to be our micro solutions, what are going to be our macro solutions, how can we try to create these systems within our friends and families to help us until we're able to get systematic change. We have to start trying to see what that looks like on a very local level. Thank you so much, Nancy. I appreciate you tuning in with us today. Thank you, Michelle. I appreciate that as well. I appreciate your comment as well. I too am a caregiver. As I shared at the beginning of the presentation, or as I talked a little bit about COVID and just the effect of the pandemic, my father was affected by COVID. So I did get kind of thrust into a caregiver role because he was completely independent prior to this. And is not very independent now, he's very dependent now. So I definitely understand what that looks like. So I have a question from Ms. Michelle. What suggestions do you have for someone who has reminded a colleague to slow down after they have vented about being overwhelmed? However, they snap on the person that reminded them. And Ms. Jackson, this happens a lot because we, as caretakers, again, we have a Superman, Superwoman mentality, and we think that we can overcome these things. I think that in this case, you have done your job. You have emphasized to the person, right? And sometimes we have to let go and let God, right? We want to show them, we want to explain to them that we didn't mean to attack them. We also don't want to take it personal because we know that anger and frustration is a part of the symptoms and the reactions that come out of caretaker fatigue, right? So it's one of those things we want to handle with care. Once we've expressed something to them, if you feel safe and comfortable to say something to maybe a supervisor or an administrator, do so. But if not, you want to just express that you are there for them, that you're sorry that they took it, or you apologize for them taking it in a negative manner, but that you are willing to be their support system whenever they are ready. What if a patient or family member really pushes your buttons and knows how to upset you? And that's the craziest part of caregiving, right? These are people who love and care for us, and they've been caring for us our whole lives. So they know what Johansei likes. They know what you like and what you don't like. So it is difficult. Again, we want to remember the situation that they are in, and we want to understand that this is not personal, right? The people who need the caretaking now are they're grieving whatever ability or whatever situation they lost. They don't want to be dependent on us either, right? So we want to establish that. And when I'm talking to people who I'm caring for, I'm always telling them, hey, I understand this is hard for you. I understand it's difficult for me to have to help you do X, Y, Z because you were doing that on your own. But it is hurtful to me, right? When you say certain things or when you do things that are not right. So I think having that open flow of communication and being very assertive about having assertive communication, not passive aggressive communication. We don't want to be aggressive with those we're caring for. We want to be assertive. We want to set those boundaries and have clear expectations. Thank you, Ms. Garcia. I'm so happy that this helped. And yes, Ms. Jackson, these should be up on the NAMI site. I'm not sure exactly when they will be. However, my email is my first initial, which is J, my last name, and I think Marquise can put this in the chat for you guys, but it's my first initial, my last name, HODGE @WIN, WIN, familyhealth.com. If they're not up in a timely manner, you just wanted them a little bit maybe before this presentation is loaded, feel free to shoot me an email. So again, that's my first initial, my last name, HODGE @winfamilyhealth.com. And I will be more than happy to send that out. But I do want to respect the timeline of the conference with them putting it up on the website. So let's kind of give them just a little bit to get that done. But feel free to email me with any question, comments, or concerns that you may have with that. Was there anything else? Yes, that is correct. No, you're missing the health, winfamilyhealth.com. I'm acting like I can't type, y'all. There we go.
Okay, I'll put it in the chat on Conference Tracker.
Okay, perfect. I hope that everybody has a great weekend. Take care of yourselves. Do something for you today. I greatly appreciate you spending this time with me on your Friday, and I hope that we get to do this again soon.
This was terrific. Thank you